this morning, like in all February mornings, since the society has decided to make this the month for us to highlight our people, although we should do it every day of every month of every year, today we will explore some black pioneers in medicine. So I will be calling this series of presentations Black Medical Pioneers. And our very first pioneer, before I tell you his name, African Americans are a very, very resilient people. We have endured hardships from slavery, Jim Crow, to health crisis in the 21st century. However, along the way, some of our people stood out as movers and shakers in the field of medicine in this country. We will talk of healthcare as if it is something that has always been a part of our culture. Well, it surely was not. The medical profession was not always open to African Americans, but even when the doors were closed, there were black pioneers of medicine striving to make a difference for the health of their people and humankind as a whole. This month, I will introduce you to some of these medical pioneers who, because of their work, made life easier for many. We take for granted how easy it is to find a black doctor in the 21st century, but that was not always the case. America did not allow blacks into the medical field for many years. But in 1837, a man named James McCune Smith became the first black person in America to receive a medical degree. Dr. Smith was one of the most broadly accomplished black intellectuals and activists in America. He was born in New York on April 18, 1813. And take note of that date. 1813, the vast majority of African Americans were in chains and in fields being slaves. He was born to a mother who purchased her own freedom and a father who was freed by his master. He grew up and attended the African Free School in New York City. After graduating from the African Free School, Smith tried his best to enroll into American universities and colleges, but his admission was denied due to the racial, need I say, and racist admission policies that was practiced in his day. He then managed to raise money and left the country to attend the University of Glasgow in Scotland, where after completing a bachelor's degree, a master's degree, he completed a medical degree in 1837. After completing a medical intern in Paris, France, he returned to New York City, where he opened a medical office and a pharmacy that attracted both black and white clientele on West Broadway. He became the first African-American doctor to practice medicine in this country, and that was far from the only groundbreaking accomplishments. He was also the first black person to own and operate a pharmacy in the United States. He was also the very first black physician to be published in a U.S. medical journal. Now, Dr. Smith practiced medicine for 20 years at the Colored Orphan Asylum in Manhattan, New York. I want to pause and tell you guys something real quick. This is not in my presentation. But the Colored Orphan Asylum in Manhattan was filled with African American children. It was burned to the ground at the beginning of the Civil War by the Irish because they did not want to be drafted into the Union Army to fight against slavery. They went on a big riot and they burned this asylum down. I just thought I'd throw that in as a bonus. Dr. Smith used his training in medicine and statistics as well as his writing talents to refute misconceptions about race intelligence, medical science, and racist notions about African Americans. He was a hardcore abolitionist and a friend of Frederick Douglass. He contributed to Frederick Douglass's newspaper, The Star, and wrote the introduction to Frederick Douglass' book, My Bondage and My Freedom. He was a member of the African Slavery Society alongside Frederick Douglass and helped start the National Council of Colored People in 1853. Now, this council was the very first permanent national organization for blacks. Dr. James McCune Smith was a well-trained physician by any medical association standard, but he was never admitted to the American Medical Association or any local New York Medical Association due to the racial practices of this country. Not only was he a man of medicine, caring for the health and welfare of black people, he also was a fighter for freedom of his enslaved brothers and sisters. This man who accomplished so much at a time in our history when most African Americans were not free. He stood tall and proved that what was possible through education, hard work, in spite of the racial hardships he suffered. James McCune Smith died of a heart attack at age 52 on November 17, 1865. He was survived by a wife and 5 children. Thank you. Good morning, everybody. Good morning. You guys ready for another story about our people? Yes. Well, today, we'll just continue with our black medical pioneers. Good health care and medical treatments have the possibility to have longevity of life and decrease the pain and suffering of every human being on this planet. The advancements in medical treatments in many cases are looked upon as God-sent miracles. However, the miracles are not in the medical techniques themselves, but are in the genius minds of the people who conceive them. Today, I will introduce you to such a person whose medical technique is still alive and practiced today. This man is Dr. Daniel Hale Williams III. Cardiologist Dr. Daniel Hale Williams was one of the first physicians to perform open-heart surgery in the United States. The former shoemaker's apprentice performed the surgery in 1893 on a man who suffered a stab wound in the heart. Dr. Williams was born on January 18, 1856 in Hollisburg, Pennsylvania. He pursued a pioneering medical career, but he didn't really start life dreaming about wanting to be a doctor, or he didn't even have medicine on his mind. As a 10-year-old boy, after his father passed away, Daniel was sent to live in Baltimore, Maryland with family friends. He became a shoemaker's apprentice, but disliked the work and decided to return to his family in Chicago, Illinois. Like his father, he became a barber and ultimately decided he wanted to pursue his education. He worked as an apprentice with a highly accomplished surgeon named Dr. Henry Palmer. He then completed further training at Chicago Medical College. Williams set up his own practice on the south side of Chicago after finishing medical school, and he taught anatomy at his alma mater, Chicago Medical College. He also became the first African-American physician to work for the city's street railway system. Williams, who was called Dr. Dan by his patients, adopted sterilization procedures of which wasn't a standard practice in the medical field at the time. But because of the recent findings on germ transmission and prevention from Louis Pasteur and Joseph Lester, he felt it necessary. Due to the discrimination of the day, African American citizens were still barred from being admitted to hospitals, and black doctors were refused staff positions. Now, being barred from hospitals, if there was no black hospital in the area, you couldn't go. And that wasn't during slavery, that was in the late 1890s. But in May of 1891, Dr. Daniel Williams decided that we've had enough of this. And he opened up a hospital called Providence Hospital and training school for nurses. And it became the nation's first hospital with nursing and intern programs that had a racially integrated staff. In 1893, Williams continued to make history when he operated on James Cornish. Now, this is what really made him famous. James Cornish, a man with a severe stab wound to his chest, who was brought to his Providence Hospital. Without the benefits of blood transfusions or modern surgical procedures, Dr. Dan Williams successfully stitched the membrane sac that enclosed the heart, thus becoming one of the first people to perform open heart surgery in the world. There were only 2 other doctors who had previously performed this operation, making him the 3rd person on the planet to do open heart surgery. The man, James Cornish, recovered and lived a long life after his operation. In 1894, Williams moved to Washington, D.C., where he was appointed the chief surgeon of the Freedmen's Hospital, which provided care for formerly enslaved African Americans. The facility had fallen into neglect and had a high mortality rate. Williams worked diligently at revitalization, improving surgical procedures, increasing specializations, starting ambulance services, and continuing to provide opportunities for black professionals. In 1895, he co-founded the National Medical Association, a professional organization for black medical doctors and nurses, as an alternative to the American Medical Association, which, as I told you guys last week, didn't allow African American membership. He left Freedom Hospital in 1898 and married Alice Johnson and moved back to Chicago, where he returned to his work at the Providence Hospital. Soon after the turn of the century, he worked at Cook County Hospital and later at St. Luke's, a large medical institution with ample resources at his disposal. Beginning in 1899, Williams also made annual trips to Nashville, Tennessee, where he was a volunteer visiting clinical professional at Meharry College. And he did this for more than 2 decades. He became a charter member of the American College of Surgeons in 1913. Today, Daniel Hale Williams' work as a pioneering physician and advocate for African American presence in medicine continues to be honored by institutions worldwide. God gave Dr. Dan a skill that was nothing short of a miracle in the late 19th century. We at Third Church can continue honoring Dr. Daniel William Hale III by regular visits to your primary care doctors and staying in the best physical shape that you can. Thank you. Good morning, Third Church family. I can't shake the foundation, but I will give you a little education. I just thought I'd throw that in. You know, it is Black History Month, and I will continue to preach that we should celebrate our history 365 days a year. So don't leave this month without checking out your history after this month is over. From the time African American doctors began to practice medicine to this very day, their main concern was the welfare of black people like themselves. Health care for African Americans from the days of slavery until very recently wasn't really the main concern of most doctors, until black doctors got involved and decided that they would correct that oversight. A lot of people think that there are many black doctors across this country. However, to be perfectly honest, black doctors make up only about 7% of the doctors in this entire nation. One of those African American doctors who was on a mission from childhood to help black people is Marilyn Hughes Gaston. Now, by the time she was 9 years old, Dr. Gaston knew she wanted to be a doctor. When she was 13, her mother collapsed at home, bleeding profusely from what was later determined to be cervical cancer. The family had no health insurance and no car to reach the medical help that was miles away. Her mother survived the incident, but the event served as a driving force in her dedication to ensuring that the poor, minorities, and the underserved and uninsured are provided quality health care. Because she was poor and black, Dr. Gaston was advised against pursuing her dream of being a doctor. However, her mind was made up, and she initially studied zoology at Miami University in Ohio, and then enrolled at the University of Cincinnati College of Medicine, where she was one of only 6 women and the only black woman in her class. She earned her medical degree in pediatrics in 1964. After earning her degree, Dr. Gaston rejected an offer to practice medicine in a middle-class neighborhood in Cincinnati, Ohio. Instead, she chose to help establish a community health center in the low-income neighborhood of Lincoln Heights, Ohio. In recognition of her dedication, Lincoln Heights and Cincinnati established a day in her honor. In addition, the University of Cincinnati College of Medicine selects 2 disadvantaged minority students annually to receive full 4-year scholarships called Gaston Scholars. In 1986, while working at the National Institute of Health, Dr. Gaston published the results of a sickle cell disease study that led to a nationwide screening program to test newborns for immediate treatment. One of the most significant conclusions of her study was that the complications of sickle cell disease could be avoided with early treatment, a life-saving practice that became a central policy of the U.S. Public Health Service. The study resulted in congressional legislation to encourage and fund sickle cell disease screening programs nationwide. Less than a year later, 40 states had begun such programs. In 1990, Dr. Gaston became director of the Bureau of Primary Health Care in the U.S. Health Resources and Service Administration. She was the first African-American woman to direct a major public health service bureau and only the second African-American woman to achieve the position of Assistant Surgeon General and the rank of Rear Admiral in the U.S. Public Health Service. Do you know who was the first? Who? Dr. Jocelyn Elders. Bill Clinton appointed her as the U.S. Surgeon General. As a director, she focused on improving health care services to underserved, uninsured, and disadvantaged families. Under her direction, significant expansion of community health centers, migrant health centers, and the National Health Service Corps occurred. Maryland was among the states to receive significant benefits from this program. Now, she was a resident of Maryland and had been since 1976. Dr. Gaston has declared her career to improving medical care for poor and minority families and to the promotion of health care equality for all Americans. She is internationally recognized for her leadership in combating sickle cell disease and changes in management of children with the illness that have significantly decreased. Now, that disease, as we all know, primarily affects people that look like us. And in years past, it was very debilitating, and there were a lot of mortalities from sickle cell. But as of today, it is not a death sentence, it is not a death warrant. There are plenty of treatments. And thanks to Dr. Gaston is the reason why. Dr. Gaston is one of the modern day miracles that God placed on this earth to help take care of us as well as all people in the medical profession. Thank you. Good morning. This is the last Sunday in February, but I have you guys know it won't be the last time you hear some Black history. You know, there are African American medical pioneers who are well known in our community. Pioneers like Dr. Charles Drew, Dr. Ben Carson, Dr. Jocelyn Elders, Dr. Mae Jemison, and others. However, the less known Black medical pioneers are just as important in their quest to make life better on earth for everyone. Some of these doctors perform medical procedures that at one time were thought to be impossible. And others became pioneers simply because they became the first to achieve a goal that had been kept out of their reach simply because of the color of their skin. Alexa Kennedy is one of these first to reach a goal that seemed so far away, but she never gave up her quest. Dr. Alexa Kennedy was born on November 7, 1950, in Lansing, Michigan, to a father who was a dentist and a mother who was an educator. Her parents taught her the importance of hard work and learning, which helped her to graduate from high school with honors. While she was attending the University of Michigan, a health careers program, summer program for minority students sparked her interest in medicine. After graduating from the college in 1971 with a major in zoology, I think the last doctor had a major in zoology, last female doctor, Dr. Smith. I think they may have geared those women Black doctors towards zoology. I don't know that for a fact, but it's a coincidence. Kennedy continued on the university medical school to pursue a medical career. In 1881, she became the first African-American woman neurosurgeon in the United States. Dr. Kennedy specialized as a pediatric neurosurgeon and served as chief of neurosurgery at the Children's Hospital in Michigan from 1987 to 2001. She initially wanted to be an internist, but her plans changed when she became intrigued by neurosurgery. It was a career path that some of her advisors discouraged her from pursuing, and she encountered difficulties in obtaining an internship with many hospitals. But Kennedy refused to give up and was eventually accepted as a surgical intern at Yale New Haven Hospital. She went there after graduating cum laude from medical school in 1975. When her internship ended in 1976, Dr. Kennedy moved to the University of Minnesota, becoming a resident of the university's Department of Neurosurgery. This, too, the first African-American woman neurosurgery resident in the United States. Upon completing her residency in 1981, she became the country's first Black woman neurosurgeon. Dr. Kennedy chose to specialize as a pediatric neurosurgeon, training at the Children's Hospital in Philadelphia. She then worked in pediatric neurosurgery at the Henry Ford Hospital in Detroit, Michigan, before moving to the Children's Hospital in Michigan. In an 1893 interview, she told this story, quote, "Although some people were at first surprised to see me, I suspected that they told themselves, she's a Black woman and a neurosurgeon, so she must know what she's doing," unquote. In 1984, Dr. Kennedy was certified by the American Board of Neurology Surgery, another first for a Black woman. 3 years later, she became director of neurosurgery at the Children's Hospital Under her guidance, the department was soon viewed as one of the best in the country. In addition to her responsibilities, Dr. Kennedy educated, researched, and taught as a professor of neurology and neurosurgery at Wayne State University. She maintained a busy schedule until her retirement from the Children's Hospital in 2001. After retiring, Dr. Kennedy moved to Florida. When she learned that there were no pediatric neurosurgeons in her immediate area, she began to practice part-time at Pensacola Sacred Heart Hospital. She just couldn't retire. Dr. Kennedy stands out as an example for those who face a difficult career path. She is also an example that you can succeed in the face of racism as long as you never give up the fight to educate yourself and to make a difference. These black pioneers that we've discussed over the past weeks are a testament that racism is an obstacle, but it's an obstacle that can be overcome with faith, education, and hard work. Thank you. Pastor. Well, like Pastor said, we will continue today with a familiar name to most of us anyway. African Americans in the field of medicine accomplished great things that made them stand out as pioneers in a profession that tried its best to keep them out. Black men and women who had the calling to become healers could not be stopped by the many pitfalls that was thrown in their way. These highly intelligent people continue to fight and prove themselves worthy of their craft. However, other people were also involved in the medical profession that didn't have MDs, that were not doctors. And today we will talk about a person who fit this bill. His name was Hamaji Phillips. A black attorney of law with no degrees in medicine became known for his efforts in fighting for a hospital that would meet the needs of the African American community here in St. Louis. Homer Gillum Phillips was his name, and he was born in Sedalia, Missouri. He was the son of a Methodist minister. However, he was orphaned in infancy and raised by his aunt. His interest in law led him to Washington, D.C., where he lived with renowned African-American poet Paul Laurence Dunbar. While attending Howard University, he also briefly worked in the Justice Department. When he returned to Missouri, Phillips became an active attorney and political figure in St. Louis. In 1922, he was given the prominent role of securing approximately $1 million to construct a new hospital for African Americans on the city's north side. While the bond issue to fund construction of a new facility to replace St. Louis's Barnes Hospital. I bet you guys never knew that. It was approved by the voters. However, city officials instead attempted to force black St. Louis residents to use the outdated Deaconess Hospital. How many of you remember Deaconess Hospital? Where it used to be a dilapidated place. Phillips led the fight against the city's efforts and eventually persuaded leaders to create the new fully funded hospital as originally proposed in the 1922 bond issue. However, construction was delayed for another 10 years. On June 18, 1931, 51-year-old Hamaji Phillips left his home at 7:45 a.m. He was going to take a streetcar to his office in the downtown area. He stopped to purchase a newspaper, which he read while waiting for his streetcar to arrive. He was approached by two men. One of the men struck him in the face before shooting him several times. The two men fled to a nearby alley. They were arrested for the murder, but both were released due to a lack of evidence. No one was ever convicted of the Hamaji Phillips murder, and no motive for the killing was ever established. And by the way, the two men were both African American. Although Phillips did not live to see the hospital named in his honor, the Hamaji Phillips Hospital was opened in 1937 to serve the city's black population and was one of the only hospitals where African Americans could train as doctors in the segregated St. Louis area. Hamaji Phillips Hospital was the only hospital that African Americans could get medical care due to the Jim Crow practices which barred all blacks from entering white hospitals. Hamaji Phillips Hospital was the only hospital for African Americans in St. Louis from 1937 until 1955. It is located at 2601 North Whittier Street in the Old Ville neighborhood. The city of St. Louis closed its doors in 1979, but the hospital in the Ville neighborhood of North St. Louis remains a treasured symbol of black achievement in the memories of the many doctors who trained and practiced there, as well as some of us who had to have care there. Hamaji Phillips, the man, achieved a lasting legacy that is still in the headlines today. He is a true black medical pioneer whose name will live for generations to come. Thank you very much.